Story 40. Not a doctor, annoying I know, but my mom kept having foot pain. Told her it was plantar fasciitis. Wouldn't heal. Then told her it was a fracture. Wouldn't heal. Then told her there was a growth. Did a biopsy and it was lung cancer. Stage 4. So from foot pain to lung cancer. Totally wild. She has also never smoked a day in her life. Story 41. An AD. Thought my Crohn's disease wasn't doing too good. Asked my gastro office to order blood tests. They requested I stop by radiology too. Worked a full day. Drove myself to the hospital for the quick tests. Even dropped off a daughter at an appointment. Came home. Potassium at critical levels. A call came from gastro's office, just as I got in my jammies. Do not pass go, do not collect $100, proceed directly to the ER. I had already had a heart attack, 3 days prior we think. Had to be hooked to heart monitors while they tried to pour K into my arms, as I couldn't digest much of anything. Spent 9 days in the hospital trying to get K and magnesium back to safe levels. Story 42. I thought I pulled a calf muscle. I did the whole rice protocol, but nothing helped. I was limping because of the pain. I ended up going to urgent care, which was a waste of time because it could be a blood clot, so they sent me to the ER. The ER did an ultrasound of my leg and found nothing. So, they gave me muscle relaxers and sent me home. They noted I should follow up with my PCP, though, because my blood pressure was really high. I chalked it up to the anxiety of being evaluated for a blood clot. A few days later, I developed this little cough and an intermittent sharp pain between my shoulder blades on deep inhales. Being that this was September 2020, I thought that this was for sure COVID. But I also then remembered that I needed to follow up with my PCP about the blood pressure thing, so I called to talk about both items at once. The nurse was alarmed and told me in no uncertain terms to go straight to the ER to be evaluated for a pulmonary embolism. And that's how I found out that I had multiple bilateral pulmonary embolisms. Story 43. Not a doctor, I work in the CAT scan department. Had a patient who came to the ER because she thought she was pregnant and wanted a test. Happens so often, why they just don't get a test at CVS. Pregnancy test was negative, and they sent her to me for a scan. Patient tells me she was having symptoms from her last pregnancy. Turns out she was having right-sided heart failure. Story 44. Was helping to move a bed down a flight of stairs. It was one of those heavy adjustable beds. Needless to say, I was pretty winded when we were done. Didn't think much of it. I had a doctor's appointment the next morning. She asked about shortness of breath as a routine question, and on a lark, I told her about moving the bed. She mentioned that it's possible I should get my heart checked out. Go to the ER at my earliest convenience. Later that day, I noticed that my back hurt. Felt like I slept wrong. No big deal. Went to optometry appointment. Got new prescription. Normal day, right? Suddenly got very nauseous while picking out frames. Threw up in the bathroom. Felt a little better, so I finished what I was doing. When we were all done, I remembered my doctor telling me to go to the ER to get checked, and I was feeling a little off from the vomiting. Went to the hospital and the guy asks, "What are you here for?" I responded lightheartedly that my doctor said I should probably get my heart checked. He hooked me up to a portable heart monitor thingy, and then shit got rushed real fast. Next thing I know, he's got a needle in my arm pumping in morphine. It was then that I learned that I'm allergic to morphine. Good times. I remember asking him if my veins were supposed to turn bright red, an itch like that. The next thing I remember was waking up in a hospital room, completely alone. Turns out I had had a massive heart attack, with one of my valves 100% blocked. They added 3 stents into various places, but the fluid was so backed up that when they opened up the valve, it flushed into my lungs, filling them with liquid. This is how they explained it to me. I spent the next week in bed, bored out of my mind, just waiting for the various diuretics to drain the fluid from my lungs. Turns out, if I hadn't gone to the ER, I'd have likely been dead within the hour. All from minor back pain and some nausea.